my name is Amelia. I'm a public health educator at MaineGeneral Medical Center. This presentation will cover basic information regarding hepatitis B. Hepatitis is inflammation of the liver. When the liver does too much work, it begins to swell and block its usual functions. So when the liver is unable to perform its job, the body begins to lose the ability to do normal things. This can cause the body to do some pretty unusual things, including symptoms of hepatitis, like tiredness, fever, joint pain, yellowing of the eyes or skin, no appetite, weight loss, dark urine, and light-colored stool. There are 5 primary types of viral hepatitis: hepatitis A, B, C, D, and E. We don't hear a lot about hepatitis D and E because those are more common in undeveloped countries with poor sanitation. However, if you're traveling abroad, it's important to look into getting precautions against those two. There are 3 common strains of hepatitis in the United States. Those are A, B, C. This presentation will cover mostly hepatitis B. So hepatitis B impacts the liver. What does the liver do? The liver has 3 big jobs: filtering, storing nutrients, and producing chemicals. The human body can't work when the liver doesn't work. Hepatitis B impacts the liver and the rest of the human body, but how do you get hepatitis B? So true or false? Hepatitis B is a sexually transmitted infection, or STI or STD. That's true. Hepatitis B is most commonly spread through sexual contact. That is typically with semen or vaginal fluids. It can also be spread during birth from mother to child. Hepatitis B is spread through sexual contact and from blood to blood contact. For example, it can be spread through unprotected sex or through sharing injection drug use equipment when there's blood to blood contact. Hepatitis B is very infectious. So how can we prevent hepatitis B? Hepatitis B is most commonly prevented through the vaccination series. Hepatitis B vaccine is recommended for everyone from birth to 18 years of age. Since hepatitis B is most commonly spread through sexual contact, it is important to remember to practice safe sex. Correctly using condoms every time you have sex, having fewer sexual partners, and getting tested regularly for sexually transmitted infections. Additionally, if you use injection drugs, there are local needle exchanges that will give you free, clean supplies. For every used needle you bring in, they will give you 1 free one. There is no limit to the number of needles you can bring in. There are also supplies like alcohol wipes, sterile waters, and sterile cartons for cleanly preparing and using drugs. For more information on the Augusta or Waterville Needle Exchange, please call 872-4102. When someone contracts hepatitis B during the first 6-month period, 95% of the people will have the virus clear on its own, with no treatment. After the first 6 months, those 5% that still have hepatitis B will have it for their life. And out of these 5% of cases, about 20% will result in severe liver damage, cancer, or liver failure. Hepatitis B can be fatal. There are several behaviors that place a person at greater risk for getting hepatitis B. The spread of hepatitis B is related to, but not limited to, the behaviors listed on the screen. Mostly, it can be transmitted anytime someone could come in contact with another person's sexual fluids or blood. For more information on hepatitis B, please visit the U.S. Center for Disease Control and Prevention's webpage, and for more information on the Next Step Needle Exchange, please visit the MaineGeneral Harm Reduction Facebook page or call the number listed on the screen. Thank you.